So what we do is we feel for the supraorbital notch, and you can feel it very clearly in Kate there, and it's level with the inside of the iris, the medial limbus. And then this is 2% lidocaine plain with no adrenaline. And so what we do is okay, what I need you to do is to tell me if you feel anything electric or like an electric shock, okay? So I palpate the notch, I put the needle straight down, simply through the skin until I touch the bone. And then I'm just going to inject right off there. I put in 2 mils of plain lidocaine. Seems like a fair bit, but it's going to do the job. Yeah, so we're doing the scalp now. We're injecting platelet rich plasma. Now in this situation we want to inject it down in amongst the bulb of the hair follicles, which are at least 5 millimeters down. With this injecting device we can gauge the depth, we can set the depth of injection anywhere from about 0.5 millimeter to 5 millimeters. So we're using maximum depth of injection at 5 millimeters. This gun produces a suction to pull the skin up, but there's no point doing that on the scalp because the hair will stop that, so we're turning the suction off. And we're injecting reasonably large doses of the PRP with each thing because we're trying to flood the hair follicles with PRP. To that. From the point of view of the hair restoration, Kate can wash her hair normally tonight. There's a little bit of blood there from the needle pricks. That will wash out fine. She might be a little bit sore on the scalp tomorrow. There might be a few little sore places to touch, but there should be no other downtime, other problem with that. As we were saying before, hair restoration is a long-term process. So what we're relying on here is for the platelets to release growth factors to stimulate blood vessel growth. And that blood vessel growth is then going to nourish the follicles that are there, enable them to grow bigger and stronger hairs. At the same time, we're kicking some of the dormant follicles into life, and we're also causing the hairs to stay in the hair follicle for a longer period, so grow longer before they fall out. All of those effects are fairly long-term effects, so Kate should see improvements in her head hair. She might start to notice that in about 2 to 3 months, and once again, the maximum result after these treatments would be in 6 to 12 months. But ideally, it would be good for her to have another 1 or 2 treatments to the scalp over the next few months to get the maximum result with this treatment.